An African child sick with malaria but no medications available. Mosquitoes that breed dengue thriving in Sri Lanka. Babies born in Bangladesh weighing too little and at risk for long-term health effects. What do all these problems have in common? The need for a different type of research that can identify solutions that work in each of these settings. It's called Implementation Research, or IR for short, and it now has a new tool produced by the World Health Organization and TDR, the Special Program for Research and Training in Tropical Diseases.
This is a great product. Designing it has taken quite a number of years. It's brought together a lot of people from different countries and different disciplines and different skill sets to make an input into this document and writing it and pilot testing it. And we're really excited that this finally, we have it now, we're ready to launch it and have people use it out there.
The Implementation Research Toolkit provides 6 modules that cover everything from an overview of what exactly implementation research covers to establishing the team and getting the results of the research into the healthcare system. The toolkit has been refined through 5 pilot tests in South Africa, Uganda, Botswana, Bangladesh and Ghana. At each, teams of a researcher, policymaker and healthcare provider brought their own projects to develop using the toolkit.
So what we're actually trying to do with this is train research teams in low and middle income countries to improve access and delivery of interventions, especially those which have been shown to work in the controlled environment of clinical trials and well-structured settings. So basically, it's building capacity to do research in a real-life context.
Here are just a few of the projects from the Bangladesh workshop that are using this process.
Many activities are being done to control dengue in our country. However, in spite of all these resources and all these efforts and all the knowledge also we have, because we know the mosquito breeding sites and we know the correct interventions, our dengue incidence go higher year by year. The dengue vector breeds in and around human habitations, and actually we need community participation to remove or eliminate those breeding sites.
We designed a $100 kitchen, and within this kitchen there is a improved cooking stove, so the mother prevent from the smoke. All the mothers are experience their traditional stoves and by small fuels, and they have the idea that if we use these new stoves and new kitchen, it could hamper their health, their environment, their cultural belief. So when we said this is a kitchen and we said that this kitchen could help you to bring the healthy baby, it is a very sensitive issue, because low birth weight newborn is not only the factor of the environment, there are multiple factors there. So implementation research, we think as we have how it could be achieved in the end of the study.
In my country, we have 2 kind of medical treatment kind of group. One is the private doctors and the other one is the government or public kind of services. And a lot of patients do go and see a doctor in the private first for any diseases. And I feel that the focal point for TB will be more in the private first, and then they come to the government. There's a delay in the TB diagnosis, because when they go to private, there's no X-ray there, there's no microscopy in these facilities. So when these patients go and see a doctor for chronic cough and fever and loss of weight, the doctor just gives them antibiotics, and the patients are not investigated for TB. So I feel with the partnership, we can actually have all the doctors refer the cases to the government services for investigation for chronic diseases like TB.
It's important to standardize because we like to have countries learn from each other. People do this kind of research across different countries. But if we have a standard way of doing it and also a structured way of doing it, then we can compare results across countries. Countries can learn from experiences in other countries and also in different contexts and settings.
I've already refined that method in our proposal so that it tailors the IRs, and I really like it. Implementation research is all about how to get things done and solved, okay?
This toolkit brings into play policymakers and equally people who are professionals in communication, journalists, and then people who know how to present information to an audience. The component of disseminating the information and feeding it back into the health system and to the end users is very, very important. Say, for example, if you've done a study where you've looked at the issues of worm infestations among school children, for example, you don't want that kind of research to just end up in the Lancet. The children who are affected by this also need to understand what the issue is about it. So you will need people who know how to package information in a format in which the children can relate to and they can understand. These are skills which your average, typical researcher in the university do not have. So you need people who have this kind of skills.
The research spectrum doesn't end at the person who does the research, does the evidence. The real power of it is when it engages with the system, with the ministries, and has an influence on policy. And again, this is not an innate capacity. It's a capacity that needs learning. It's a skill that needs to be created.